My name is Sage McKee, and I'm going to be doing my IV push competency. First thing I'm going to do is compare my doctor's order to my MAR. I'm making sure that I have first the right patient's name, the right medication, dose, time, and route. I'm comparing the two, and I do. I'm checking for any allergies. My patient does not have any allergies, which is great. I'm going to be giving IV push of furosemide, which is a diuretic. We're going to be giving them 40 milligrams, which is 4 milliliters, over 2 minutes, and so that would be 1 milliliter every 30 seconds. Coming into my book, and I'm checking for furosemide, making sure that I have the correct dilution, the correct rate of administration. Each 40 milligrams should be given over 1 to 2 minutes. 2 minutes is preferred for safety. For precautions, I am checking for any excessive diuresis. I am monitoring the blood pressure frequently, and I'm checking for any electrolyte imbalances. I'm also checking to make sure that it is compatible with the primary solution already running, which is normal saline, and it is compatible, and I know that because my book has told me it is compatible. So at this point, I can get all of my equipment together and get it ready. So I'm going to perform hand hygiene. Alright, and I'm going to get my syringe, my blunt needle, my medication, which I am checking for the expiration date and checking that it is furosemide, and checking that it is the correct dose. I've got an alcohol pad to scrub my hub, and I have my tag saying my name, my patient's name, what they're getting, which is furosemide, 40 milligrams, which is 4 milliliters, what day it was prepared, which is today, and the expiration date. So I can then label syringe, and I can draw up my medication. Alright, I'm checking that it is 4 milliliters, and I can then recap by scooping it. So I've got my medication ready. I've got my alcohol pad, and I can now enter the patient's room. So, hello, my name is Sage McKee. I'm a student nurse at MCC, and I'm going to give you your IV push medication by using the port closest to the IV site. You are getting furosemide, which is diuretic, which all that's going to do is kind of get rid of some of the fluid that is in you. We have edema. And so I'm going to wash my hands. Can you tell me your name and date of birth? And I am checking it on the wristband and also checking it verbally, so I have 2 identifiers. And can you tell me if you have any allergies, which I do not, which is perfect. Got my gloves. I'm checking the medication that is running, which is the normal saline, which we have already checked is compatible with the medication that we are giving. And now I can check if they have any allergies. Do you have any allergies? No? Perfect. Now I'm going to scrub the hub for 15 to 30 seconds. Oh, But before I do that, I want to make sure that my line is patent. The drop, looking for blood return, which is good. Checking the site for any sort of infiltration, redness, edema, swelling, warmth. Everything looks good. And now I can get another alcohol pad and scrub the hub for 15 to 30 seconds. Okay. And I can now grab my medication and attach it to my hub. So 4 milliliters over 2 minutes. It's going to be 1 milliliter every 30 seconds. Make sure everything's not clamped. And I'll give my first milliliter. And I'll let this go. And I can pinch and give my second milliliter. And I'll let that go. I will pinch and give my third and let it go. Pinch, give my last milliliter, and let it go. I am checking the site for any redness, warmth, infiltration, or edema, and there is none. And I can clean off that, properly dispose, making sure that my patient feels safe and comfortable. The wheel's locked, bed in lowest position, call bell in reach, and have it let me know if they need anything. And now I will go properly document.